Good afternoon. Thanks for coming out. And I want to first thank John Rother for his leadership of NCHC. I guess he's been the new CEO for about a year, and for his vision of what direction to take the organization. As he noted, it was founded about 20 years ago by Henry Simmons. In the early years, it was mainly making people aware that the healthcare system was broken, that we could do much better. And now the organization has turned more to advocacy and with particular focus on the cost containment issue. I want to also thank Larry McNeely, who's NCHC's manager for policy communications and advocacy, who was the primary author of the document. And also I want to recognize the rest of the small NCHC staff. It was a great job, and everybody made important contributions. So as John has told you, it brings together a number of proposals for cost reduction and quality improvements, and they're very nicely organized, I think. They're packaged together. A few of them are extrapolated from ideas. A lot of them are, out there. The focus is primarily on the federal, Medicaid, Medicare, but clearly many of the ideas apply across the entire healthcare system. So two important parts about the proposal. As John said, they avoid blunt cost cutting and cost shifting to patients, providers, and the states. And in addition, they're not pie in the sky, untested, untried ideas. And I want to specifically focus on that CalPERS is doing many of the things that are in this report and is planning to do some of the others, and they are working. PERS is in pension investments, is our two of our businesses, but we're also the second largest employer-based health plan in the U.S. after the federal employees plan. We have 1.3 million members, and we're very concentrated. Almost all of our members are in California, which gives us some leverage. We'll spend about $7 billion this coming year on premiums. Some will be the employer and some will be the employee contribution. And of course, cost containment is our major challenge. The plans we have include Kaiser Permanente, which is an HMO, about 40% of our members, Blue Shield of California with a couple of different HMO plans, and 3 PPO plans from Anthem, managed by Anthem Blue Cross. We self-insure on the PPO, by the way. We also provide Medicare supplement plans. So here are some examples of the kind of things that we have done and have proven successful. One is limited hospital network. About almost a decade ago, we looked at our hospitals in the Blue Shield HMO, and we did made cost estimates of risk-adjusted costs and quality measures. And then that study revealed, first of all, as many of you probably know, there is virtually no correlation between cost and quality in the healthcare business. And so we took hospitals that were unreasonably expensive and weren't offering anything more in quality, and we removed them, about 25 of them out of the HMO network. We would have taken more, but the laws required us to keep some in. That savings was about $35 million in the first year, and has increased to about $50 million as our estimated savings by not having those hospitals in. By the way, one hospital came back into the network, a San Diego area hospital, lowered their prices enough to get back in our network. Now, what's interesting about that is that they lowered the prices not just for CalPERS members, but for the entire Blue Shield book of business that for all the Blue Shield patients. Blue Shield added a limited primary care physician network as another way of getting at costs. Qualified physicians based on quality of service, and then looked at the ones who did it most cost effectively and created a new plan that they call net value, and that saves about 10%. Premiums in that plan are about 10% lower. We have episodic bundled payments and reference pricing. Our Anthem Blue Cross PPO now caps payments for knee and hip replacements at $30,000, and member pays anything above that. It falls on the member. 95% of our members in Blue Cross plan are within 50 miles of facilities that will do the job and meet quality standards for that price. The other 5% will provide transportation to. Generic drugs. We have always pushed and encouraged use of generic drugs. We recently, starting in this year, member pays the difference. If a member uses a branded drug where there's a generic equivalent, the whole difference in cost falls on them. Now, what surprised many of us are elected members from employee organizations, was that there was very little pushback from these individuals and their leadership. Increasingly, our members and employee group leaders realize that compensation is sort of a single pot, and if the healthcare costs are unreasonable, wasted, they're going to end up feeling it in lower compensation, maybe even furloughs and layoffs. Our PPO manages high-cost patients with a nurse coordinator, and the results there are dramatic reductions in emergency room admissions and readmissions to hospitals. So that's just a sampling of some of the things we're doing. We have an RFP out on the street now asking bidders to it solicits ideas from bidders. What can you do in the area, for example, of potentially avoidable complications? We've had a study that suggests if we could remove unnecessary, inappropriate treatments, eliminate those, we could save on the order of $500 million over a 3-year period. It doesn't mean you can't get rid of all potentially avoidable complications, but that represents about a third of them eliminated. So these examples represent major areas of cost reductions. And as John said, there's no silver bullet. Somebody else said, well, there's a lot of silver BBs. And so here are some of PERS silver BBs, some of them which are, I guess I wouldn't want to drop in my toe when you're talking about millions and millions of dollars. So we hope that this plan will, backed by the experience of organizations out there who have implemented some of these ideas, and by what you'll hear from the panelists, will encourage our nation's leaders in the healthcare arena to take action, serious consideration, take action on our recommendations. Thank you.